It's times like this when the power and the value of the STEM learning ecosystem's community of practice becomes very visible. Presented by STEM at Home, an initiative launched by the STEM learning ecosystem's community of practice, STEM Community Conversations is a series of conversations for teachers, school officials, community leaders, and the many others impacted by school closures and virtual learning. For those of you new to this initiative, the STEM ecosystems, operated by Kaiz, which you can find at stemecosystems.org, harness the power of business and industry, funders and foundations, K-12 schools, higher education, and more to find solutions to common problems and to build thriving communities. Embracing the ecosystem way, these gatherings will provide a space and time for leaders to share common challenges, ideas, and resources. Conversations will revolve around successful models and new ideas to support STEM learning experiences during and beyond this time of social distancing. These are interactive conversations where you will have the opportunity to ask your questions to our experts. So make sure to enter your questions by clicking the Q&A box at the bottom of your screen, where you can also upvote the questions asked by others. My name is Jeremy Shore, and thank you for joining us today for a conversation about race in America and COVID-19. Listen, folks, I have a very strong feeling that there are going to be a whole lot of questions today. So make sure you start entering those questions early and make sure to start voting on the questions you see so that we can get to as many questions as possible. We are joined today by Dr. Rashawn Ray, the David M. Rubenstein Fellow of the Brookings Institution, and Dr. Calvin Mackie, President and founder of STEM NOLA, STEM entrepreneur, speaker, and author. Dr. Rashawn Ray, a David M. Rubenstein Fellow in Governance Studies of the Brookings Institute, is an Associate Professor of Sociology and Executive Director of the Lab for Applied Social Science Research at the University of Maryland, College Park. He's also one of the co-editors of Context Magazine, Sociology for the Public. Formerly, Ray was a Robert Wood Johnson Foundation Health Policy Research Scholar at the University of California, Berkeley. Ray's research addresses the mechanisms that manufacture and maintain racial and social inequality, with a particular focus on police-civilian relations and men's treatment of women. Dr. Ray, welcome.
Thank you for having me, Jeremy. I really appreciate it.
And Dr. Calvin Mackie received his degree in mathematics from Morehouse College and a degree in mechanical engineering from Georgia Tech, where he later earned his master's and PhD in mechanical engineering. In 2002, Dr. Mackie was tenured at Tulane. In 2009, Dr. Mackie was appointed to the Louisiana Council on the Social Status of Black Boys and Black Men. He serves as the board-elected chair to lead the state's efforts to create policy and programs to positively impact the quality of life for Black males and families in the state of Louisiana. Dr. Mackie is also, as you all know him, the founder of STEM NOLA, an organization created to expose, inspire, and engage members of the surrounding communities about the opportunities in science, technology, engineering, and mathematics. Welcome, Dr. Mackie.
Hey, thank you, Jeremy, for having me. It's always good to join STEM ecosystems.
Thank you. All right, Rashawn, let's get straight to it. What has COVID-19 uncovered in the area of race and equity for America, and why is this important right now?
Well, obviously what COVID-19 has exposed is, and of course, I wrote a series of pieces at Brookings aiming to highlight why the gap exists in race and then what we can do about it. I think the first big thing is that COVID-19 we've seen is essentially an equal opportunity virus. But unfortunately, our healthcare system and our education system and STEM as a whole in many regards is not equitable. And we're seeing that oftentimes collide on the bodies of the most oppressed and the most vulnerable. That oftentimes becomes Black Americans. I mean, I think when we talk about COVID-19, what we know about the data today is that Blacks are over 3 times more likely to die from COVID-19 than other racial groups. That's nationally. And we have to be clear that Blacks only represent about 13%, 14% of the population, but account for nearly 30% of all COVID-19 deaths. The disparities we're seeing in Michigan and Illinois, Maryland, Kansas, Louisiana, I mean, they are honestly things that should unnerve us all. And a lot of it centers on the inequitable distribution of resources in our healthcare system.
Yeah, I think that this is the thing that we've talked about it, in the ecosystems and beyond for a really long time. But this is one of the first times that it's become kind of really in this big national spotlight. And what's, I hate to say something is positive about the pandemic. But if we're looking for positive things, I think this is maybe one of our first big opportunities to come together internationally to address these inequities. Calvin, what are the consequences? This is highlighting this inequity. What are the consequences of an inequitable society?
I'm in New Orleans, and I had the unpleasant experience of living through Hurricane Katrina. In the aftermath of Hurricane Katrina, I spent a lot of times talking about Katrina being a great teacher and the lessons from Mother Nature. And we talk about our lives now as pre-Katrina, post-Katrina. And I think with COVID-19, we're really gonna start talking about our lives pre-COVID and post-COVID. And it's very important, Jeremy, that we document the lessons that came this pandemic. And for the STEM community, I want you all to know this is our moment. This is our Sputnik moment. The entire world right now is waiting on the STEM community to save them. The police can't, the army can't, the politicians can't. This solution, there's only two ways. I mean, Mother Nature either is going to be tamed through a vaccine, or she's going to be mitigated through therapeutics, i.e. drugs. So you have all of these researchers with STEM degrees, you have all these medical doctors with STEM degrees, but this is a public health catastrophe, a STEM disaster. Because when you look at supply chain, you look at manufacturing, all of the things, all of the careers that we are saying that our children should be learning the 21st century skills to go into, are the careers that are under the gun and under pressure to deliver solutions to not only tame the disease, but also help and mitigate the rest of us while we wait for them to come up with a solution. So when you look at these injustices, right, and you can break them down not only into the healthcare, before the disease arrived, you know, we had disparities in housing, transportation, employment, education, health, but even the environment. So when we start talking about the death rate of Blacks and Hispanics and low income, low resource communities, at the end of the day, when they do the research in these urban areas, you know, 2/3 of the people dying are Black and Hispanic. But when you go out to the rural areas and the disease spread out there, it may not spread as rapidly because the people are not as condensed. You're gonna find that these disparities are leading to outcomes that a country should not be comfortable with at any time in its existence. But I want the STEM community to know, this is a call to action for us to make sure that we are addressing STEM and STEM literacy in every community, not just in the communities that we live, play, and reside.
You know, I think that you bring kind of two important things to light there in what you just said so passionately. And the first of those, to me at least, is, you know, I come from education. A lot of folks who are on these calls come from education. We've spent a lot of the past, you know, 20, 30 years marginalizing sciences within our school programs at you know, in communities across the country. And that's not, you know, the kind of stated reason for that are these math scores and ELA scores and all that stuff. And math and ELA are really, really critical, but so is science. And this is, I think, an opportunity for us to really, really show that we need to be developing the next generation of epidemiologists, of doctors, of researchers. But the other thing that you brought up that I think is really critical, I'd like to ask Rashawn about a little bit. Rashawn, why are people of color getting sick and dying in disproportionate numbers? What's the mechanism that's causing this?
Yeah, the main reason why we see a racial gap in COVID-19 has to do with structural conditions. And I think there is a very simple way to help people make sense of this, then I'll explain it. If you have because we have to be realistic that there's a lot of blame game going on, aiming to blame people's behaviors, in particular Black people's behaviors, aiming to say that something is genetic or biological when underneath the skin we're basically the same. So it's not those factors, and research has shown that. Instead, I want you to think about if you have $10 in your pocket and you have to feed a family of 4. Will you go to the Whole Foods that doesn't exist in your neighborhood, or will you go to the McDonald's on the corner? I think everyone will make the same decision. That, in essence, is how we see structural conditions playing out. Predominantly Black neighborhoods relative to other neighborhoods have less access to healthy food options, meaning fewer grocery stores, fewer places where they can get healthy fruits and vegetables, oversaturated with fast food places, less healthcare access, fewer hospitals, fewer specialty care, fewer urgent care clinics, fewer pharmacies. Pharmacies that do exist oftentimes don't have the type of prescriptions that people need. So in this time period where people are being sent home oftentimes with prescriptions, it might take 3 or 4 days for someone to get their prescriptions in certain neighborhoods. Those are days they don't have. We also know that predominantly Black neighborhoods are also oftentimes in denser areas. So social distancing becomes a privilege. And then we know that when it comes to work, these new essential workers, people who work at grocery stores, people who work at restaurants, bus drivers, train drivers, individuals who we now realize, sanitation workers, that we need in our lives to actually survive, are overrepresented among Blacks. Blacks represent about 20 to 25% of these occupations. So we put all this together and we see that structure is actually playing a role in this. And I do think that there's a lot that STEM can do to deal with this. One example, one of my colleagues, Dr. Nicole Turner Lee at Brookings, has been dealing with the digital divide as it relates to education and technology. One big proposal, she said, and Austin has done this, but people should do this across the country, is equipping school buses with Wi-Fi, getting companies, Verizon, AT&T, Comcast, to equip school buses. And school buses have their own places where they go. You put those in neighborhoods and instantly you have kids who can access Wi-Fi in an area oftentimes where they don't have that. That's in urban communities as well as in rural communities, which to Calvin's point, I really, really worry about it as this moves forward.
You know, we had a really great conversation a couple of weeks ago with Vint Cerf, the chief evangelist at Google. And one of the interesting things that came out from that conversation, so Vint was talking about not only this digital divide, but also the fact that this digital divide, which has always been present, is now having this much deeper impact because students who have access are continuing to learn and students who don't, their learning has stopped. And he actually started a conversation with one of our ecosystems and some of the fancy folks at Verizon specifically to address that issue. But we need to be thinking broader. That's one, awesome solution, but it's in a microcosm and it's not kind of going broader than that. So I want to start going to the questions that we're getting from the audience because they're starting to pour in. But I want to ask
Jeremy,
one more thing.
May I add
of course.
around that, Jeremy?
Absolutely, yeah.
Before we go to questions, in 1999, I wrote an article, and a quote I had in that article, I don't know if you all remember, in 1999, we was talking about Y2K. And everyone was afraid that, hey, the system was going to collapse and the world was going to go dark overnight. And I wrote an article, and a quote I wrote in the article was that we have to be careful that in our communities, we don't become sign-carrying hobos on a super information highway because no one was building on and off ramps in our community. So 20 years ago, we was talking about the same issue. We was talking about when we were laying the fiber optic, when we was first talking about the internet, when we was talking about Netscape and browsers, the technology companies of today was not investing in these communities 20 years ago, such that now they are complicit in this issue. If you look in urban America, 30% of households don't have computers and nearly 27% don't have access to high-speed Wi-Fi. If you look out in the rural area, that's very comparable. We got to talk about politicians because over the last 8 years or the 8 years of the Obama administration, they made an amazing effort with something called E-rate to lay broadband access in the rural areas, and many governors turned it down. They are complicit in the fact that our children, there was an article last week coming out of the state of Georgia where students in a rural area outside of UGA, college students were parking outside of the Chick-fil-A just to try to get access to the internet so that they can do their homework. No kid in the greatest country in the world, when we talk about American exceptionalism, where is it when we got our children outside of Chick-fil-A trying to get access so that they can do their homework? If we're gonna move this thing forward, and I brought up the fact that I said it 20 years ago, because Katrina was 15 years ago, COVID is today, and the STEM community cannot stop talking about this when we find a vaccine and move on.
Yeah, Calvin, this is something that we've all been thinking about for a while and a lot more. And I would like to go to some questions from the audience here in just a second. But you bring that up. And so here's the hard question for the two of you, I think. I can't comprehend how this is a thing in 2020, but I read reports like those coming out of Brookings about the inequality of care for this pandemic. I see protesters waving signs with pictures of rats wearing a Star of David and with the word, let us go back to work, focus on the real plague. I just can't comprehend how this is still happening in 2020. It's really easy for us to wear t-shirts that say equality, right? But what can we actually do to change this? How can communities immediately respond to address these inequities today?
So, I think we have to be honest that unfortunately, racial inequality and specifically structural racism is baked into the fabric and the recipe of our country. And so we first have to be honest about that. I had the chance to interview Congressman Hakeem Jeffries at Brookings, and one of the things he said is that the United States has a genetic birth defect on the question of race, and we still haven't properly addressed that particular question. In terms of what people can do, I think one of the first things people can do is they can contact their policymakers and propose these solutions that we're talking about now, that we're going to be talking about, like Wi-Fi buses, handing out laptops, doing these sort of things that in the interim can really help to close the digital divide that we know is going to further exacerbate education inequality. We can contact our officials and tell them. There's an app that I've been telling people about called The Countable that allows you to put in your zip code and your address. You can contact your elected officials. I think one of the other big things that we can do is we have to take a broader framework. You said, what is the big picture here? Well, this is the big picture. We know that in the United States, healthcare access and healthcare quality are huge concerns. On a recent report, the United States was #1 out of 195 countries in terms of supposedly being prepared for a pandemic. As a university professor, we only scored 84%. Yeah, that's okay, just nothing to write home about. But we only scored 66% when it came to healthcare access. And oftentimes this healthcare access and the lack of quality collides on the bodies of Black, brown, people living in urban communities, people living in rural America. And in rural America, most counties don't even have one hospital bed. So I really worry about the impact that COVID-19 is going to have on those particular communities. But the main point is this: we need to transform the colorblind approach we've been taking to COVID-19, transform that into a health equity approach by centering the most vulnerable among us, people in low-income communities, people in predominantly Black and Latino communities, people in rural America who are white and Black who are struggling. And once we do that, all of a sudden policies start to look a bit differently. We see that in certain states, Ohio, we see it in Maryland, we see it in California. These are governors across the board who are Republican and Democrat who are aiming to do things to scale up a health equity approach, to implement health equity zones that can then start to be hubs in impoverished communities to deal with, honestly, all the issues that STEM aims to address.
All right, on that, I'd like to go to one of our attendees, Jessica Bates. Jessica, are you there with us?
Yes, I'm here.
There you go. Hi, Jessica. Could you ask your question?
Yes, so COVID has highlighted the inequities of access to education in students of color, creating the homework gap and highlighting the digital access disparities. So as an education-focused nonprofit, how do we advocate for digital equity and access for all, knowing that traditionally marginalized students are in the center and in the most need?
Calvin?
So that's the point I'm making about once COVID is over. I mean, I live in New Orleans, we have water everywhere, but another thing is roaches. Roaches are everywhere, right? And what you'll learn if you live in this part of the country is that, you know, if you come home and you turn the light on, roaches scatter. And I did some research, Jamie, on roaches to see why the roaches scatter, because I always thought it was the light. And what I found out is that the roaches have some type of genetic makeup such that the light actually causes them pain. And for many of us, when we start talking about inequities, especially inequities that align along race, it seems like we have a genetic makeup that causes some type of pain and forces us to run away from it when the light is on, where the light is on now. The way we address it is that we keep the light on. We make sure that funders, and I had this conversation last night, is that we must make sure that we don't allow funders to get off the hook of making sure that resources track the disparities. You know, you see funders now, you know, buying 500 computers here, making sure everybody got Wi-Fi access here. And people got mad with me last week because I was on the news and I said, those kids didn't have computers last month. I mean, they were behind in homework last month. They couldn't go home and Google last month. So what is it now such that the spotlight is on and you can get your shine on, you're gonna deliver 1,000 computers, but you didn't deliver them a month ago. We have to have courage to speak truth to power and continuously speak to funders in a way such that they won't forget what's happening right now.
Yeah. I do. Sorry, go ahead, Dr. Ray.
I was just going to quickly say, I mean, we talked about some of these, you know, shorter term solutions. On a broad scale, we need to completely restructure how school funding is allocated. There's a very powerful book too, actually, by Jonathan Kozol, The Shame of a Nation and Savage Inequalities, that shows how in the mid-90s, we shifted from federal funding that was more equitable as we went from the 60s to the present, to all of a sudden, local property taxes driving school funding. So if you're in New Orleans, or you're in Washington, D.C., or you're in Boston, or you're in an impoverished neighborhood, then your school is going to get less funding for schools. This is the reason why we see this. There was a large report that came out that showed that predominantly Black schools compared to predominantly white schools had about a $23 billion deficit when it came to school funding nationally. I mean, we're talking about billions of dollars. If we really want to restructure this on a grand scale, what we needed to do, like what Delaware has done, which is aim to equitably redistribute school funding that comes into the state to be sent to schools across the state. And these are things that all of us can demand on a local, state, and federal level if we really want school to be equitable.
And let me add to what Rashawn is saying, because some of these solutions that we're given are long-term, and I want to make sure also that we have some very short-term solutions. So Jessica, I'm in the same boat as you. I'm a community-based nonprofit, and I want to let you know what I'm doing in the short term that otherwise you may be able to use to address the issues that you're addressing and we'll have to address. I have prepared like a COVID-19 action response list, because I believe, and I know in my soul of soul, based on my experience with Katrina, that the world post-COVID will be different than the world pre-COVID. If you've written grants to different community foundations and different funders, you need to make a list. I mean, make your own response list on how you are pivoting in your delivery of service, and use these inequities, point out these inequities that exist, and ask them for funding that you can specifically address these issues in the here and now, not in a tomorrow, in a by and by. But we need to start making a pivot now. And you need to put the pressure on them, put it before them. I'm the type that believe if I don't ask the question, I'm never gonna get an answer. So I'm gonna ask the question. So make your list and send it as broad as you can to the people who otherwise fund things in your area.
You know, policy, as we know, policy change is incredibly slow. Just as an example, potential example, I'm in Ohio. In 2001 and 2002, I think, don't quote me on that, the state of Ohio's school funding program, or a formula, was found to be unconstitutional by the state Supreme Court. So 3 different times, 20 years ago, it was found to be unconstitutional, but it's still the same. It hasn't changed. What can people do right now to accelerate the shift in policy and to get policy moving towards more equality to address these situations?
So I think oftentimes what happens with policies are oftentimes mandated federally and implemented locally. So I mean, if we look at the Affordable Care Act, for example, that has been drastically different, whether if you're in Ohio or Mississippi, Louisiana, or Maryland. With that being said, we can do a lot on a local level. In our cities, in our communities, we can attend town halls, we can attend events. And I get people saying that policy moves slowly. However, I actually think that policy moves faster than people think. As an example, look how quick this COVID-19 package was put in place. Like, they can move fast if they're pressured to do so. And I think that's the key thing, is that oftentimes what happens is that we put someone in office, and this is a collective, not necessarily an individual thing, but as a collective, we put people in office, then we wait around to talk about what they did over the past 2 to 4 years, instead of actually putting pressure on them to do what they do locally. A lot of the work I do is on policing, and I can tell you that people say that that space moves slowly. I've been able to get a lot of movement across the country on these sort of things by working locally, grassroots, with organizations like a lot of the people who are on this call, to band together to say, what sort of response are we going to put together? As an example, Ohio and Michigan right now just put together task forces to address the racial gap in COVID. Now, Michigan was way late. I think Ohio is getting ahead of it. If people are in those states, you should be at those tables. Because as we know from Shirley Chisholm, if you're not at the table, then you're on the menu and somebody's eating you for lunch. So you have to bring a folding chair. Like, we have to put ourselves in those spaces. I've been able to do that. And when you do that, there are a lot of things we can do locally. Now, that's on an organizational level. I also want to talk, because someone asked specifically about individuals. Like, what can I do as an individual? Well, look, in our everyday lives, there are things that we can do on a very micro level that make a difference in people's lives. If you have a barber or a hairstylist, send them some money. If you know a family that might be struggling with equipment and you have an extra laptop or you have an extra phone, figure out how to get that to them. And these might seem like really small things, but a lot of people want to know what they can do. And you can literally change a family's life by providing them with access to this technology so that a family doesn't fall behind during this time period.
Yeah, I've seen some really cool programs. There's one happening in New York that's also happening here in Cleveland, where you can donate money. That money goes to restaurants so they can keep the restaurant workers employed to cook and then use the food that they cook to serve to both people without homes and jobs and frontline workers in this pandemic. So you get to be helping not only kind of those main people, but also people who work in kitchens are likely to have a smaller safety net, so you can continue to keep them employed. I've got a really interesting question here from Jasmine Turner. So I'd like to unmute Jasmine if we can. Jasmine, are you there with us?
Yes, I am. Hi, how are you?
I'm doing well. Jasmine, would you like to ask your question?
Sure. So I just have to begin my question with some context. So I am African, Japanese, Chinese American, and my mother grew up in post-World War II here in America. In 2017, I was a park ranger at Arlington House, which is the Robert E. Lee Memorial. So it's been emotionally exhausting just dealing with the public online. I haven't even dealt yet with our museum's public, but one of my Asian American friends and his family were threatened with being shot last month because of COVID-19. And while all of that was going on, I am also involved in several other online groups, and I've been seeing frustrations from African Americans, especially just their frustrations with the anti-Black prejudice and racism that they've been dealing with for many, many years, coming from Asian and Asian American communities. So my question is, how do we use intersectionality to bridge the anti-Asian and anti-Black prejudice that these communities are pointing at each other?
Rashawn?
Yeah, well, Jasmine, I'm so sorry to hear about your experiences and the experiences of your friends and your family. I mean, I talk to a lot of people who are experiencing discrimination right now, people who are Asian, people who are perceived as being Asian. Of course, one of the unfortunate things in our society is that it's not always what you identify as, it's the way that people oftentimes perceive you. And we see this across the board. Black Americans wearing masks, continuing to be criminalized when they're actually taking care of themselves and others. I mean, we even go to Asia and we see Africans being kicked out of their homes and being kicked out of restaurants. So we see this across the board. What can we do to merge, say in this case, the experiences of Blacks around the world with the experiences of Asians? There's a recent study that highlighted something profound. Experiencing discrimination doesn't do it. So on the surface, I think a lot of people think, oh, okay, I experienced discrimination, this other person experiences discrimination. It's gonna lead to us having some empathy with each other. No, that actually doesn't work. Actually, what works though is community building, which a lot of people on here are doing, sharing people's stories. You get people together, showing that there have been similar trajectories and of course some differences in regards to, say, Black Americans and Asian Americans. And of course, we have to be realistic that a lot of the things that we hear in social media, mainstream media, are meant to kind of divide certain communities. And instead, we should be coming together. So I think that community building is extremely key. And what does that look like? That looks like holding a forum. And I think you mentioned intersectionality, you have these intersectional identities. It becomes people like you being able to sit in the center and merge communities together to have initially difficult conversations, but saying, what can we bring out of this so that we can get on the same page? Because as Calvin was saying, we're at this break point where, I'm always cautiously optimistic. If I didn't do my job, I wouldn't be that way. But history tells us that not much will change. I mean, after the Civil War, after the Great Depression, we fast forward, Katrina, obviously. I mean, it tells us that a lot won't change, but we can be the change we want to see. So I think when it comes to Black Americans and Asian Americans, we can bring these groups together. They don't talk a lot, to tell you the truth, and you know that. And so part of what we have to do is say, we have similar issues. How can we come up with similar recommendations to, I think, create a larger voting block, to create a larger block of people with resources to help change the communities that we live in?
Calvin, you do a lot of work with community building. What has this looked like for you?
Yeah, that's, I'm over here and I'm about to jump out of my chair because the beauty of this conversation is Rashawn and I are coming from two different perspectives, almost like the left brain, right brain. I'm the scientist, I'm the engineer, I'm the STEM cat, and he's, the policy cat. So a lot of times we start talking about policy and coming together and having a meeting. I mean, my mind want to explode because all of my training in STEM was about doing. But as I've done and done more, I've gotten a greater appreciation for the coming together in the conversation piece. So what we've done in New Orleans, I wanted to bridge the gap that you're talking about, because in our communities, in many African-American communities, many of the stores are owned by people of other ethnicities. And, a lot of the stores here are owned by people of Asian descent. And one thing I noticed was that people had resentment for the stores owned by the Asians and the Arabs because they didn't do anything to support their community. So it's very difficult for me to run to your side when the discrimination is against you, when we have been obviously discriminated against on CBS News and everything, and we don't see the people that's making money off our community running to us. First and foremost, that has to be addressed. If you're gonna be a member of the community where you make money in the community and you extract from the community, then you should be invested in the community. At STEM NOLA, what we've done through STEM, and I want to get back to the STEM part, is because we believe that a high functioning community, no matter where you go in the world, is child-centered, adult-governed, elder rule, meaning that every decision made is focused on the child. The adults are the ones that have to do all the work and put in all the energy so that they can free up the elder, i.e. the professional or older person, so that they can have time and energy to pour into the kids. So what we've done is created a high functioning STEM community where we focus on the kid. And the reason why I keep saying focus on the kid is because when we focused on the kid, that brought the community together. All of the differences that adults had, they forgot about them because they saw something of high value to their children. So we have these big events where we have people from different ethnicities, different socioeconomic backgrounds coming together, and these kids are creating community that they'll never forget. And within these communities, now we can have these conversations because we found a common place to meet. And the common place that we're meeting in New Orleans now is the STEM part. And just to add a little bit more about the policy piece, the fact that we are bringing all these different communities together, when the politicians came out and they saw, we have a large Vietnamese community in New Orleans, when they saw, the number of Vietnamese at our events, and they saw the white kids, they saw the black kids, they saw them working together, they saw the parents, then we began to change the narrative of the politicians, such that now we're in the city budget because they're saying what you're doing is so important. So instead of taking it from a conversation to the STEM, we use the STEM to create the conversation to get what we needed on the back end.
And that's an opportunity that any organization, really has, but you've got to have faith that it can happen. You have to dig in and start doing the work, which can be really hard to do, right? When we have this messaging constantly that is showing the opposite of equity, it can be really hard to just jump in and try to do the work and then bring the policymakers to you. I have an interesting question here, and I sincerely apologize. I have no idea how to say your name. I'm going to go with Wacinque. So please correct me. Are you there with us?
I am.
How badly did I say your name?
It's Wacinque.
Wacinque, perfect. Got it. Thank you.
Well, basically, my question is going beyond the known knowns. Everything that has been identified is known knowns. The social determinants, the lack of an investment, and so forth. So how are we going to move past these knowns to some change? Because what we know is, in spite of having conversations like this in the past, we still arrived at a point today where there's disparity in the impact of COVID. So basically, what's the roadmap to a different future?
And Wacinque's question in the chat was specifically about, you know, on the medicine side, that we're seeing these disparities in people of color, both getting ill and dying. But I think it expands beyond that, right? To all the things that we're talking about. None of this is a surprise. None of this is a surprise. We've talked about this before. We talked about this after Katrina. We talked about this after other major events, but we keep reliving it. How do we break this cycle?
Well, Rashawn, may I go or you? Or do you?
No, go ahead, Calvin.
Okay. I like his question, but the simplicity of it bothers me because this is a very complex problem, and simplistic answers definitely won't solve it. On my YouTube page and on my social media, I'm running a video called "The Government Ain't Coming." And I say ain't on purpose, because in my life, the government has never came. In the aftermath of Katrina, when 40,000 people was on the street of New Orleans and the whole world was watching it, it took the United States government 5 days to get to New Orleans. Actually, the Canadian Bluecoats got to New Orleans before the federal government did. So Wacinque, I'm not the one to think that the government is, you know, somewhere in a clandestine meeting trying to say how we're gonna do what we need to do to make sure that Black people don't continuously die from these inequities. Now, if that happened, that ain't great. So what I am focusing on, and my focus is empowering individuals and empowering communities and empowering organizations to do what they can do, because I know a mighty storm starts off as a speck of sand coming off the tip of Africa and across the Atlantic Ocean that turns into a storm. So it takes years and years to turn this big ship around, but there are things that we can do at the local level to make a difference. For example, we know that all research show that if you're a white person, you get better health care. And why do you get better health care? Because there are more white doctors, there are more white nurses. I mean, these conscious and unconscious biases are built into people. So we are fighting, and we've been fighting to try to get more kids to go into healthcare, to become doctors, to become nurses, or to go into research. Those are the things that we can do with our little bitty power, with our little bitty energy to say, hey, this little starfish here, when I threw it out in the ocean, I knew that starfish lived. I may not be able to throw all of them out there, but don't be overwhelmed by the problem such that we think that there is no solution, when if each and every one of us do what we can do, no telling what may happen in the near future.
Yeah, I'll say a few things. First thing, I have a book coming out next year with Dr. Holden Mahmoudi. One of the things is it's all about education and education inequality. And one of the big things that we highlight in that book, or what I highlight in the chapter that I wrote, is what I call a racial equity framework that has 3 components to it. The first is how we become a racial equity learner. The second is how we become a racial equity advocate. And the third is how we become a racial equity broker. I'll quickly break those down. Essentially what we're doing now is engaging in racial equity learning, right? We are all kind of aiming to scale up our knowledge base. So learning is key. Second is become a racial equity advocate. I talked earlier about sitting in rooms where you essentially have to bring a chair. Oftentimes those rooms are highly segregated. They are our kitchen tables, they are our dining room tables, they are our family tables during holidays. And oftentimes people are talking about groups that are not present. If you're really an advocate, you speak up and speak out at those moments to transform discussions. When you're simply an ally, you know, you can sit up and wear a white pin and just kind of go along. Now, I have nothing against wearing the pins and being in solidarity. But when you're in solidarity, you can be silent. One thing my grandfather told me, who served 21 years in the military, Purple Heart, Bronze Star, fought in 2 wars, that our silence is our acceptance. A lot of what we have to do is to not be silent so we can become advocates. We have to transform and shift allyship to advocacy. Those are 2 very, very different things. We talk a lot about allyship. I see allyship as being very reactionary. Advocacy is very proactive. Third, we can be racial equity brokers. This means looking at the organizations, the institutions, the companies that we work in, looking at the policies and regulations that are in place, that be our universities, our companies, our organizations, and saying, how can we make these more equitable? And then how can we test to make sure that equity exists? And in places where we don't see equity existing, what policies, rules, and regulations can we put in place to correct this? I do a lot of work with companies and organizations, including the federal government, the military, Department of Homeland Security. Believe me, these are very, very difficult places. I work with a lot of police departments. I mean, you want to talk about difficulty trying to make change related to race, I could talk about that. And I know that this process works. So what we have to do is actually become racial equity brokers and aim to transform some of the ways that rules and regulations, which seem to be neutral. This is where it gets back to what I was saying about how we've approached COVID-19 has been a colorblind approach. You can't take a colorblind approach to something that is already inequitable. You actually have to center equity to do that. By centering equity, you take a more proactive approach to this. So I definitely get some of these things. And of course, since I'm in the policy space, I do see change happening there, but I also see a lot of change that we can make in our organizations, in our states, in our local governments, and in our schools to actually make rules and regulations more equitable.
You know, there's a thing that I always worry about because on one hand, I think that allies, the general population being in support of change is a really critical component to change. On the other hand, I always worry that that for many people, if you can call yourself an ally, that checks the box in your brain that you're doing something. This is what I did. I became an ally. And then I worry that it reduces the likelihood that those same people will take action. And I never really know what to do with that. I do think that there's another component that we need to potentially think about. I got an interesting text from one of my colleagues, Lekeisha Harding, and I'm going to bring her mic on live here to ask it about kind of really knowing what we're tackling in order to tackle it. Keisha, are you there with us?
Yeah, can you guys hear me okay?
We can, Keisha.
Awesome. And thank you everybody for coming out and joining us. This is such an important conversation. I feel like when I have these conversations a lot, something that always comes up is the historical connection of our economic disparities in association with the racial ones. They kind of were developed around the same time and historically have been super connected. So my question is, how can we help people identify when it's an economic issue and when it's a race issue? Not both, not one or the other, but how do we make those, how do we distinguish that? Because sometimes I think it's hard for people to do so and to really focus on the racial issues because it's so linked to economics.
I mean, I don't think race and economics are separate. So for example, in 1860, Black enslaved people were worth $3 billion. Their bodies. We haven't even got to the products they produce, the cotton and the land and the buildings, the Georgetowns, the Princetons and all that. Just their bodies were actually worth more than factories and the railroads. So when we talk about race and social class and economics, they are intrinsically linked to one another. And I think we actually do an injustice when we separate them. So we only focus on social class. I actually think that's taking a colorblind approach. We actually don't address the fact that racial inequality is embedded within it. I think part of the issue is that oftentimes people aren't comfortable having those conversations, that they are linked. That's part of being a racial equity learner. Like most people don't know how much Black people were worth in 1860. That's part of the reason why when people talk about reparations, we have a dollar amount to put on it. Like you can't separate the fact that Black bodies, which happen to be what we call African Americans and Black Americans in this country, had a dollar value placed on it. We can't hide the fact that in Washington, D.C., that slave owners were given reparations for those Black bodies after slavery ended following the Civil War. And of course, that's also linked to when we talk about the Great Depression and we talk about the fact that Black Americans didn't get GI Bill money and Social Security money. And to be specific about it, we had Black and white Americans going over fighting in World War II. When they came back from that war, the New Deal was enacted and mostly white Americans were able to send themselves to college, send their kids to college, start up small businesses, actually put down payments on homes. Very interestingly, pretty much very similar to these CARES Act that we are enacting now with COVID-19. Black people are being excluded from that. Right now, for example, with small business loans, I've been doing these analyses. One thing we know is that states that have high Black populations, Louisiana, Georgia, and Maryland, have been less likely to get small business loans during COVID-19. We can't separate those two. And if we continue to do that, we'll continue to see the inequities that exist in our country.
And I'll take it even back to STEM. And I'm glad you brought up, Rashawn, I'm gonna call you every day. You need to talk to me at least 5 minutes every day, man.
Let's do it.
I'm gonna bring it back to STEM. In 1944, something happened that transformed the African-American experience in this country. People know about the Emancipation Proclamation like 1867 and things like that. But in 1944 in Clarksdale, Mississippi, in the Delta of Mississippi, they rolled out something called an automatic cotton picker. And this one machine picked cotton equivalent to 100 bodies. In the aftermath of the Emancipation Proclamation, Jim Crow ushered in sharecropping, so many of the blacks in the South couldn't leave the South because they was yoked to a slave economy. So when they rolled out the automatic cotton picker, and then the farmers, the white farmers was able to replace the black bodies with these machines, that exacerbated the migration of African Americans from the South to the Northeast and West. I mean, the blacks that left the South when they worked for General Motors and Ford at the River Rouge plant in Detroit, and still talk about how they was the last hired and the first fired. So what we are seeing is that these things cannot be disconnected, and that's why STEM is so important, because it was STEM, the creation of the automatic cotton picker, that disenfranchised the African American from the slave economy, and it was STEM in the 1990s that disenfranchised the middle class worker from their jobs. When AT&T laid off 40,000, IBM laid off 44,000. That was the first time in this country where we saw STEM impacting middle class white people. So the economic angst that we're feeling in America now is due to the disenfranchisement of everybody through the advent of STEM. But it started with African Americans and the automatic cotton picker. So as Booker T. Washington said, we're separate as the fingers, but as whole as the hand. We cannot talk about the disparities without talking about race. The disparities that exist right now, like we're seeing, there are white communities with the same disparities, but they're not having the same debt rate. And what it goes down to is the race component. If you control for race, you get your answer. If you don't control for race, you're only confused.
Yeah, listen, and I'm not gonna lie, right? I consider myself a pretty obnoxiously liberal guy, and this stuff, it makes me uncomfortable. As we discussed before, I'm a white man from suburbia, and this stuff makes me uncomfortable. So how do we, if I'm uncomfortable, and it's hard for me to talk about this, how do we get the nation as a whole to talk about this and to feel comfortable so that we can address it?
Yeah, I'll make a couple quick points on that. I think change is mostly made when we experience the most discomfort. So I don't necessarily think we can change unless we're uncomfortable, unless we're learning something new. I also think, to the typology that you made about yourself, I think Black people can make that too. Like, we can look at people who are currently in this administration who think very differently, have very different experiences. Let's say myself and Calvin. That's okay. Like, Black people are heterogeneous, white people are heterogeneous, Asians and Latinos are heterogeneous. We don't have to be the same. But I want to make a point, 2 quick points about how we think about change. First is, and neither one are right, it's just important for us to think about this dichotomy. Dr. Quincy Stewart is a professor in Northwestern. He was one of my mentors in Indiana, where I got my PhD. He used to always give me this analogy, and we wrote this paper about the race flood. So imagine you're in a river and you see people drowning. You can swim, you jump in, you try to save them. You save that person, you pull them out, you see another person drowning, you keep jumping in. If anyone has ever saved someone from drowning, that is an extremely excruciating experience. You are exhausted because they're fighting you while you are pulling them to safety, right? Because they're scared, they're anxious, they can't breathe. Now, eventually, somebody's gonna say, who keeps throwing all these people in the river? And we have to go look at the source of the river. The source of the river are our social institutions, it's our government, and people are okay to attack the source of the river, like people can also pull people out the river. People can also do both. It's not necessarily an or, it can be an and. And I want to make a relation to how we think about STEM. So you mentioned earlier, I'm the executive director of the Lab for Applied Social Science Research. We call it LASER in Maryland. What we do is we develop innovative virtual reality products. We've developed virtual reality products for police officers and law enforcement, Department of Homeland Security and the like. And now we're currently going into the prison space to take virtual reality into prisons to train people when they get out of prison to be better prepared for work. We brought in computer scientists, we brought in mathematicians, we brought in corporations. I mean, we've gotten grants from AT&T, from Google, from USA Today to build this innovative virtual reality program. I think it fully represents STEM as we are bringing social sciences with computer sciences and the like. And the key point is we then apply that. We take that program and put it into police departments. It's a virtual reality decision-making program. And Jeremy, you made a point about changing people's minds. Well, when the light is lit, it's an opportunity to move. And we know that from what happened in 2014, that the movement for Black Lives has galvanized a lot of people. People are paying attention. And one thing I know, a key stat I always say, is that over 50% of whites say that when they see an incident between a Black person and a police officer, that they think it's something bigger going on. That's a huge shift from anything that happened over the past 10 years. Over 50% of whites. If you got over 50% of white people saying something's wrong with policing in America like that, that's astronomical. So a lot of people know it's a problem. Then you tell them what to do about it. So you say you could take your money and donate to this program. If you don't know exactly what to do, if you got the money, you can do that. You can help us bring this program to your police department. So I use policing as an example because we know that in policing, Black Americans are 3.5 times more likely to be killed by the police when they're not attacking, nor when they have a weapon. That stat should disturb, and it oftentimes does disturb everyone. So then it becomes, what do we do about it? Well, we can improve police officers' decision-making. That's one thing. Of course, we can change laws. That's another thing. But both of them matter. And so when it comes to STEM, that's the space that I'm in terms of doing the kind of work that is applied, but also thinking about policy at local, state, and federal levels.
And quickly, people change. I believe people change for one or more 3 reasons. They're given enough, they learn enough, or they heard enough. And usually no one changes until they hurt. And I hope this spotlight that COVID is shining is making white people hurt, because the Black community is absolutely hurting. And my dad dropped out of school in 8th grade to pick cotton. This stuff that I'm talking about is not superficial to me. It is very tangible. I have 3 sisters, and every one of my sisters at this moment, while I have the privilege with my PhD to be on this nice Zoom call talking to people across America, I have a sister who's a respiratory therapist who's gearing up every day with PPE, doing what she got to do to intubate people. I got a sister who's a manager of a local grocery store here in the city. Every day she got to go and make sure that people get their groceries. And my other sister is in social services, and every day it hurts my heart that I'm sitting here doing this safe, and they're on the front line. So this is personal, and we have to do things. You know, think about those people. Think about my sisters and their kids at home. Think about the low income, low resource communities and kids who don't have access to Wi-Fi right now, don't have access to computers right now, and to STEM ecosystems, don't have access to STEM. I mean, how many of us are willing to put together little STEM kits and make sure while they're giving out food at the schools, you can drop STEM kits off at the school so that the kids can get STEM, DIY STEM kits that, you know, that they can do out of kitchen products? How many of us are willing to put together, download STEM coloring sheets off the internet and make sure that when they go home, kids got crayons and STEM coloring for the K-2 so we can remind them of STEM? There are things that we can be doing as a community STEM ecosystem to help people make it through this. And when you do stuff like that, when we do with STEM NOLA, one of the great things that come back to us, many times parents have come to us and said, you know what was really special? I said, what? They said, you thought about us. People just want to know that they matter. And when we have STEM programs and we put it on the other side of town and expect people who don't have transportation to get on a bus and make it to our STEM programs, when we have STEM programs and we have marketing that doesn't necessarily speak to every community and expect the people to translate it and come to us, we are complicit in part of the problem. So I hope this spotlight forces us to behave differently such that we can be there for people. And I just want to add this. I started off with my dad, and my dad told me something that allowed me now to have a plethora of friends like Jeremy. My daddy said, son, all white people ain't racist, but all white people white. And there's something that comes with that. And I mean, that freed me, because I realized then that some people just don't know. And I give them the opportunity to make mistakes, and I can be there and correct them. Like, nah, that isn't the case. I just wish and hope that those people, when they find out the truth, they accept that truth and then behave differently.
Thank you, Calvin. I mean, you had a lot of practical things to say there, and I think that's a good way for us to close. We just have about 3 minutes left, and there's one other question I'd like to sneak in here that's a very practical question for us to address before we close today. Candace Thompson. Candace, are you there with us?
I am.
Hi, Candace. Could you ask your question?
Sure. First of all, thank you all so much. It is a privilege and it's inspiring to be with all these smart people who are using their intellect in the service of something that lives on the ground, lives and breathes on the ground. So my question is, what do you say to Mama G in my neighborhood, who sees the inequity, endured the generational oppression, has been harmed by being underserved in healthcare, education, employment, and housing, and who still wants to contribute to reimagine possibilities?
Well, I mean, I'll quickly say two things. I think the first thing is to check on her. You know, we're talking about practical things and other things. There are a lot of people in our communities who haven't been able to go to the grocery store. They don't know how to order Instacart. They don't even have a computer or a phone to even do that. So first, check on them. Let's make sure they're okay. Let's see what they need. If people have kids, like I have an 8 and a 9-year-old, and you know, to Calvin's point, my wife is a healthcare provider. She runs her own health clinic on the front lines every day, seeing what those people go through. Check in with them and see if they need anything. If other kids are in the classroom, make sure that they have the supplies they need. Make sure that they have a printer where they can print off stuff. Oftentimes parents need help with technology, so we can do that. Second big thing I say to the woman in your neighborhood is sometimes we need to go listen to them, because the lessons they've learned along the way, we can take those lessons and actually package them for solutions of the day, because they've seen what worked and what hasn't worked. I remember when I was working at the University of Michigan and they were putting the Greenway in, and local Black residents didn't want it, and the city government didn't realize it. They were like, why don't they want this? I asked an older Black woman, and she said, nobody asked us if we wanted this. She said, we have all these other problems. They could have spent that money in better ways. So the wisdom that comes along with an elder in our community is, I think, something that we don't maximize enough.
Hey,
Calvin?
Hey, please let me, Rashawn, that was great. But again, I want to go back to community, right? I said community is child-centered, adult-governed, elder rule. And when we do all of our programming, our STEM programming, you know, that's vertical mentoring. So we've created a space for everybody. So at our STEM programs, we've created a space for the grandmothers and grandfathers. I mean, we line the streets with signs so the kids can feel comfortable when they come to the STEM programs. When we're talking about equity, we think about it to this point, right? So kids get online and they see kids doing STEM and they have on real lab coats. Well, when I was doing my STEM programs, I said I can't have my kids with no paper lab coats on, so I had to spend more money to make sure I got real lab coats so my kids know that they value. But the grandmothers are coming, and the grandmothers are volunteering at the registration. The grandmothers are volunteering to give out the food. I mean, the grandfathers are coming and say, son, they call me son, that's all good. Let me put out the signs. So the point is that we've thought about everybody and created a space for everybody. And when you bring that community together, you get the wisdom that Rashawn talked about. I have a book called Grandma Hand's Proverbs for Life and Living. And I always want that wisdom at the table so they can direct me. Also, I released a article today on Forbes called STEM Coronavirus, the Crisis Within a Crisis. And a lot what we are talking about in terms of digital literacy and access to health is in that article if you all are interested in it. So thank you for having me.
Thank you, Calvin. Thank you, Rashawn. People have value. People need to know that they have value. Ask the people that you want to help what they actually need. And I think one of my biggest ones, don't just pull the people out of the river. Find out who's throwing them into the river in the first place. This has been STEM Community Conversations from STEM at Home, brought to you by the STEM Learning Ecosystems Community of Practice. Thank you for joining us today for Race, America, and COVID-19. Thank you, Dr. Ray. Thank you, Dr. Mackie. These community conversations will revolve around successful models and new ideas to support STEM learning experiences during and beyond this time of social distancing. Stay tuned to STEMecosystems.org for upcoming shows, and please continue to participate. I'm Jeremy Shore. We'll see you next time.